My journey in psychology was really to help people who had excess weight and health conditions who maybe already knew what to do but were having a hard time doing it. I work in the area of weight management, and I'm a psychologist, an exercise physiologist, and a dietitian, so I kind of cross over in different disciplines. They're there to see me to kind of deal with some of the psychological aspects of eating, sometimes binge eating, emotional eating, sometimes just with motivation for changing their diet or to start exercise. People don't care how much you know until they know how much you care. And so I try to really build a relationship with my patients, let them know that I care first of all, and then everything else comes a little bit easier after that. We talk a lot about things that may have happened in the past. We talk a lot about things that are going on right now, and just trying to empathize with them, but also make them feel hopeful that there are things that they can do to change. So my first visits are usually a get to know you, tell me why you were referred here or what you hope to get out of today's session, and then it's usually more of a general assessment. So I go through history, we talk about their weight history, we might talk about their mental health history, what kind of support they have at home. So we cover a lot of ground in the first visit. And then from there, we talk about some next steps. I want the care to be collaborative. I really believe that there might be different avenues for different people, and I just want to understand what that person values and how we can integrate that into what we're doing. When people seek treatment in the Department of Endocrinology, we have lifestyle change throughout. I work closely with the endocrinology team, so the physicians, the endocrinologists, the dietitians, the exercise physiologists. Also, we work cross-discipline, so sometimes people have been referred from bariatrics because they've decided they don't want to have surgery or they want to try medications first. Or sometimes, like I said, I will see people who've already had bariatric surgery and they might be struggling with maintaining behavior change. They're enjoying their time with their kids or their grandkids. They're able to travel and feel comfortable doing that. So those are the stories that are really rewarding. I have two really active teenagers, so I am going to sporting events about every night. But I enjoy riding my bike a lot and being very active myself.